Yes, we bought personal protective equipment at almost double the market rate, but it was justified, says the government. But that's not the only headache facing the health ministry. Nurses have warned they will down their tools on Monday the 10th if their concerns, which include lack of adequate PPE gear, are not addressed. Leila Mohammed reports on the launch of an additional isolation and treatment unit at the Kenyatta University and those rather expensive face masks.
In the wake of nation media groups' revelations of questionable spending of coronavirus response funds, the government has come out to defend itself. The Ministry of Health says the Kenya Medical Supplies Agency's purchase of personal protective equipment for figures beyond the market prices was justified.
We got into the market at a time when this demand was extremely high. But because we had an emergency, we had to contend with the situation as it was.
Records show that the agency procured 5,000 pieces of N95 masks at an outrageous unit price of 1,300 shillings against a 700 shillings market price apiece. The agency also bought over 1.8 million pieces of KN95 masks at 700 shillings a piece against a market price of 450 a piece, among other tendering irregularities. Kagwe says there is nothing wrong.
Price is largely controlled by demand and supply schedules. We started addressing our local capacity for the production of PPEs to make sure that we were not subjected to prices that were not cost-effective to our service delivery.
Kagwe's sentiments have been echoed by ODM leader Raila Odinga.
All of a sudden, people require millions of this. People require sanitizers. You need ventilators, and so on and so forth. So it is emergency. And procurement, you're talking about farms which will be given a contract to supply and so on, suggesting that the government should deal only with established companies with track record and so on and so forth. You're basically promoting monopoly. And when we are saying that we need also to promote the youth in the country.
Most of these PPEs were meant for frontline medical workers in various isolation and treatment facilities across the country, but hundreds upon hundreds have contracted the virus themselves while on duty.
As at yesterday, 8 of them had passed on, and today you have reported another 2. That brings us to 10 healthcare workers.
Kagwe spoke as he launched an extra 500-bed isolation and treatment unit at the Kenyatta University Teaching and Referral Hospital. 60 beds have been set up for specialized care, ICU, HDU ward. Leila Mohammed, NTV.